life. Kinesiology is the study of human movement. The healthcare professions of occupational therapy, physical therapy, physiatry, and recreational therapy use this body of knowledge as a fundamental part of the physical rehabilitation process. This presentation features several persons with mid-level quadriplegia who demonstrate how these kinesiologic principles can affect the efficiency of their movement. Understanding how these principles can enhance their functional potential is a fundamental theme of this program. Research will undoubtedly lead to significant improvements in the control of functional movement following spinal cord injury. These improvements may stem from advances in medical treatment, bioengineering, laboratory research, and computer-assisted technology. In conjunction with these advancements, innovative therapeutic approaches may further promote the return of motor function. Although promising, these efforts will take considerable time and financial resources and may offer only limited benefit for some persons. It is important, therefore, that health professionals continue to research and teach kinesiologic principles that maximize the ease and efficiency of functional movement, regardless of the extent of paralysis. This video features 11 subjects with quadriplegia, each functioning at the C5, C6, or C7 motor level. Based on the classification system designed by the American Spinal Injury Association, or ASIA, all subjects are classified as either ASIA Class A or B. That is to say, the subjects have no motor function and varying sensory awareness below the level of their injury. Individuals were chosen for this project based on their ability to demonstrate specific kinesiologic principles. The functional abilities of the subjects vary considerably based on factors such as personal history, motor and sensory injury level, body type, time since injury, athleticism, and problem-solving skills. At the time of filming, subjects' time since injury ranged from 6 months to over 20 years. This video was produced by the combined efforts of 3 sources. Marquette University's Physical Therapy Department in Milwaukee, Wisconsin. The Zablocki VA Medical Center, also in Milwaukee, and the Paralyzed Veterans of America, based in Washington, D.C., who funded this project. This video presents a blending of academic and clinical perspectives. Dr. Donald Neumann is an associate professor in the Physical Therapy Department at Marquette University. Much of his writing, research, and teaching has concentrated on kinesiologic issues related to movement dysfunction and physical rehabilitation. Ms. Michelle Lanouette is a physical therapist at the Zablocki VA Medical Center. She specializes in the physical rehabilitation of persons with spinal cord injuries, beginning immediately following injury and continuing throughout the patient's transition back into the community. This program consists of 2 parts. Part 1 first reviews the muscle function at the C5, C6, and C7 motor levels. This is followed by a demonstration by subjects of the selected kinesiologic principles that pertain to movement and the maintenance of important functional positions. These principles are presented in a proximal to distal order, starting at the scapulothoracic joint and ending with the wrist and hand. In Part 2, subjects demonstrate how the kinesiologic principles are used to facilitate functions, such as transferring to and from a wheelchair, rolling, and coming to a sitting position. It is important to realize that the subjects shown in this video are medically stable and have completed their formal physical rehabilitation program. The functions demonstrated in this video are not necessarily appropriate for all persons with a spinal cord injury. A qualified medical professional needs to assess the appropriateness of such activities for each individual. These activities are usually performed as part of a physical rehabilitation program. Parts 1 and 2 focus primarily on the technical aspects of functional movement following a spinal cord injury. Equally important, however, is the motivation and commitment required to master these movements. These important characteristics will be addressed further at the conclusion of this program.